Thank you for tuning in to MRSB Podcast. I am Dr. Ivan Phua, and I founded MRSB Clinic in 2004. I am an MOH accredited liposuction doctor and medical aesthetics doctor based in Singapore. I have been trained directly under Dr. Alfredo Hoyos and Dr. John Millard for basal liposuction, Dr. Pierre Fournier for liposculpture, fat grafting, and thread lift. Also by Dr. Delgado for dedicated surgical training in gynecomastia surgery in San Francisco. Today we'll be talking about man boobs. Man boobs basically just means enlarged male breasts. Could be due to gynecomastia or pseudogynecomastia, in other words, pseudogyno. So what is pseudogyno? Pseudogyno is an enlarged male breast mainly due to thickened fat deposits around the breasts. Your breast glands could be normal, could be small, or could be just slightly enlarged. But most of the enlarged size is due to thickened fat accumulation. So how does it develop? Pseudogyno is often associated with weight gain, aging, and sometimes even genetic factors. Can you get rid of pseudogynecomastia? Yes and no. As I mentioned earlier, pseudogyno is mainly due to enlargement, thickening of accumulation of fat cells around your breasts. While theoretically, you can exercise, you can lose weight, and the fat cells will go away, right? But it's not as simple as that. So since pseudogyno is caused by thickening accumulation of fat cells around your breast, can you lose it when you lose weight? So yes and no. Fat cells in your breast are usually more stubborn and resistant to weight loss than other areas. So when you lose weight, you will find that yes, the breast may reduce in size, but it may not go away. Can pseudogyno be treated with non-surgical treatment such as fat freezing, radiofrequency treatment, or other fat reduction treatment available at the current moment? Well, the answer is yes and no. And in theory, if the fat is thinned out or reduced using all those treatments, then your pseudogynecomastia should improve, right? But in reality, it often doesn't. Because first of all, you may or may not respond to those treatments. Secondly, even if you do respond, you may not get a symmetrical, even response throughout your whole chest. So the worst case scenario is you may get some flattening certain part or portion of the breast, leaving other parts untouched. And you may end up with a unnatural shape, indented patch, uneven breast. Treating gynecomastia or pseudogynecomastia involves not only removing the excess tissue that is a cause of it, but also to create or to sculpt your chest and breast so that it look normal and natural again. So non-surgical methods may not be able to do that based on my experience. An interesting fact that I gathered from my years of seeing patients is that a lot of patients coming for consult often claim to have pseudogynecomastia. But after assessment and examining them, most of them really do have gynecomastia. Pseudogyno is not as common as one thinks. Thank you for listening. I hope you enjoyed the podcast today. If you do have any questions, please feel free to send it to us. We'll be glad to answer all of them.